Hello and welcome to Talk to the Experts here on 770 CHQR Radio. I'm Betty Jo Kaiser, and joining us in studio today from the HeartFit Clinic is its founder and director, Diamond Fernandez. Diamond, also an author, Beating Heart Disease. Congratulations on the new book.
Yeah, thank you very much.
That's so exciting.
Yeah.
Diamond, I heard the statistic the other day, and it always kind of shocks me a little. More women die of heart disease than all the cancers combined.
Yeah, it's not a man's disease anymore. And of course, it's the leading cause of death and hospitalization of men and women in Canada. So,
Wow. Yeah. So when you think about it, my first thought is I got to get me to my doctor. Like I got to get to the family doctor.
Of
The
course.
HeartFit Clinic, you're special. You are specializing in heart disease prevention and treatment, right?
Yeah, exactly. Yeah.
So if I'm starting off with my doctor, what am I going to get there?
You know, I think going to your family doctor is a good start for sure. What the HeartFit Clinic does is we do the best screening test to see where your risk is of a heart attack or stroke. And we also have the best treatment options to prevent and reverse heart disease. And that's the big key that we do. Now, how we differ than going to your family doctor, I think going to your family doctor is a good start. And, they can check your blood pressure. They can check, to see if you're diabetic and whatnot. And we'll get into the cholesterol side of things a little bit later. But there's not much in their toolbox to see where your risk is of a heart attack or stroke. So, yeah.
One of the things is if they see some warning signs, they may send you to a cardiologist.
Yeah. And so from a preventative level, whether it be you've had a heart attack or a heart event or some kind of heart problem, or you're there to prevent that, when we go to our family doctor, like I said, it's a good start, but it's, a lot of times you can walk out of your family doctor's office with a clean bill of health and still be on the path of a heart attack or stroke. And I'll get into that, right away. And so some family doctors might refer to a cardiologist. And so on a preventative level, I think where cardiologists really excel is if you are in the hospital,
right,
with an emergency. I think we got the best cardiologists, I'm going to say, in the country here in Calgary.
Right.
And we're very fortunate for that. But they're really good from an emergency perspective. And I think where, I won't give an A+ mark to that, is preventing the disease process,
right,
whether it be primary, meaning preventing your first one, or secondary. So let me explain that a little bit more.
Yes.
Just because we've all heard of the exercise stress test and the ECG, the electrocardiogram. And those are important tests to get started with. But the concern with those tests is that when you look at the artery, and I'm going to give an important stat here, is that the majority of heart attacks and strokes occur with blockages that are less than 50%.
Wow.
Yeah. And so I always talk about your arteries are a muscle, they're not a pipe. And
right,
when you look at it from that perspective, if your arteries are a muscle and not a pipe, how is it that this blockage, that 50%, the majority of heart attacks occur with blockages that are less than 50%? So I always like to equate it, it's like a pimple on your face. Everyone out there has had a pimple on their face. Yeah. And if that pimple, everyone's had that pimple pop before.
Mm-hmm.
Now that pimple is protected by a layer of your skin. Imagine that pimple is like a plaque inside your artery.
Okay.
Right? And so when you look at that, a blockage or something that's obstructing the heart, the artery muscle, when we look at that, if it's less than, the majority of heart attacks occur with blockages that are less than 50%. And then the vast majority actually occur with less than 70%. So my point is that if that pimple pops inside your artery, if that plaque pops, it goes from a small blockage, let's call it 30%, right to 100% very quickly.
And that's bad.
And that's bad. That's a heart attack.
Yeah.
And that's where, if you're having that heart attack, that's where we have the best treatments available here in Calgary, and that's going to the hospital.
Right.
Right? Yeah.
And so my mom had a stent put in many years ago.
Yeah.
And I was reading an article in the New York Times, and it says heart stents are useless for most stable patients, and yet they're still widely used.
Yeah.
So that's what you're talking about. That's an emergent.
Yeah.
Stents are emergent.
So I think there's a time and place for stents. And I think when it's an acute problem, meaning it's an emergency, that's where stents are used best, right? And so when we look at, I'm going to take it back for a second, just when we look at the stress test, where you're walking on a treadmill and you're exercising, and we're looking at your ECG while you're exercising, the concern with that test is it'll only show advanced stages of disease. So you actually have to have a blockage inside your artery. It has to be 80% or more before it actually starts to show up on that stress test.
I see.
Right? And so many times people can walk into a cardiologist's office, and from a preventative level saying, you can go to your family doctor because you got to get referred to a cardiologist. You can go to your family, I want to know where my risk is, or I'm having these chest pains and I kind of want to investigate them. And the fact is that your arteries are a muscle, right? They're not a pipe. And so when you go to a cardiologist, they're only looking for advanced stages of disease.
Yes.
And if you're not advanced enough, you can get dismissed.
Right.
But I just finished telling you that the majority of heart attacks and strokes occur with blockages that are less than that, right? And so the key is with the HeartFit Clinic is we bridge an important gap in our healthcare system.
I was just going to say, how do we know? How do we find that out?
Yeah. And so let's take it a step further even. We hear about cholesterol.
Yes, we do.
Yeah.
There's good cholesterol and there's bad cholesterol.
Of course, but even taking it a little bit further than that is that the majority of people that have heart attacks and strokes actually have normal cholesterol profiles.
Really?
Yeah. And so when we look at that and we say, okay, well, I don't have high cholesterol, I don't got to worry about it. And the fact is that, I spent some time, we were just nominated for Most Innovative Company, and we were down in the States here, just in San Diego.
Congrats.
Getting that, we were one of the finalists there, so it was great. And what happened is that there's a lot of talk about gun control,
yes.
And with all the problems, and I'm, being
this
Canadian,
is big right now, yes.
And I equate cholesterol like guns. And, if we eliminate all the guns, yes, you're going to minimize the
impact
problem.
And the violence.
But the fact is that guns do not kill people. Just like cholesterol doesn't kill people. What happens is that people using the guns is what kills people.
That's right.
Right? And same thing was with cholesterol. Cholesterol only responds to inflammation. And many people have heard that terminology out there. It's inflammation. And
so that's interesting.
Yeah.
So there needs to be a catalyst.
Yeah.
Okay.
Cholesterol can float around your bloodstream all day long. I don't care if it's low, high, medium, it does not matter. The fact is if you have inflammation, that's a big
the problem.
Thing. Yeah. And the HeartFit Clinic is the only clinic in Calgary that offers two things really that are really important. We have the most accurate screening test to detect your risk of a heart attack or stroke in the next 5 years. And that's called the protein unstable lesion signature. I'll explain that. Basically, when we look at the proteins that are unstable lesion signature means blood test. Mm-hmm. Lesions means, I'm going to go backwards on this. So lesion means a cut, like a cut or a blockage. Okay. Unstable, right? We're looking for unstable lesions, right? Which is cuts or blockages. And then there are specific protein markers that is not available in our healthcare system to see where your risk is of a heart attack or stroke in the next 5 years.
Okay, so you mentioned that you have tests that you can't get anywhere else. You're a specialist, right?
Yeah.
You're a specialist in that. Is there anything I can do now to determine, geez, that inflammation, that might be me?
Yeah. And we can get into that a little bit in a bit, but when you look at inflammation, there are many causes of inflammation.
Right.
And that's why I wanted to share that when we look at cholesterol profiles, it's important to look at that because we can see trends, right? And I think it's important to look at trends with cholesterol, but not just to say, okay, you have high cholesterol. And for those people that are taking a cholesterol lowering medication, in my opinion, many times people are on that for not a good reason, right? Just because you have high cholesterol it means it's like I was talking about with the gun analogy. You just got too many guns, so let's just decrease the amount of guns. It's not the problem, it's inflammation. So really we're looking at the wrong thing.
Okay.
And now there are drugs out there that we can pretty much wipe off cholesterol as a risk factor for heart disease.
Wow.
Right? And in spite of doing that, we're still seeing a number of, we can take cholesterol down by 75%. Like LDL cholesterol, the bad cholesterol.
The bad stuff.
Right? But here's the big thing, and I've talked about it before, and is the LDL cholesterol, the bad cholesterol, comes in different shapes and sizes. And I talk about that too, is that the artery is protected by a tennis net-like structure.
Okay.
You have tennis ball-sized particles, which are large and fluffy. They will not go through a tennis net.
Right.
And you have golf ball-sized particles that will go through a tennis net and cause problems. Now, those golf balls is what we do at the clinic, is we look at to see where those smaller, what I call, I'm going to use a bigger word here, atherogenic particles.
Okay.
So we're looking for atherogenic particles inside your blood to see what that risk is from there.
I'm Betty Jo Kaiser. We are chatting with Diamond Fernandez. He's the director of the HeartFit Clinic. Heartfit.ca, 870-4348, or long distance, 877-700-4348. 4348. We do have to take a break, but we have way more information coming up this hour. I want to know more about this HeartFit clinic because you are one of a kind in this part of the world.
Yeah.
Like in Western Canada?
Pretty much. I mean, yeah, we fill an important gap in our healthcare system. That's what I'm very passionate about what we do.
We'll be back we'll be back shortly to hear more after this. Hello and welcome back to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser. Diamond Fernandez is joining us today. He's the founder and director of the HeartFit Clinic. Their website is heartfit.ca. You can call them 403-870-4348. That's 403-870-4348. Or long distance 1-877-700-4348. Another quick congratulations, Diamond. You have a brand new book out, Beating Heart Disease.
Yeah.
Folks can get a copy of this at your clinic.
Absolutely.
Oh, that's so exciting. Okay, so just before we went to break, we were talking about cholesterol. And we were talking about the good, the bad, the ugly. It doesn't really matter. It's the inflammation that's the problem.
Absolutely. And so we were talking about particle sizes, right? And so you got the small and the large. Those small particles are the atherogenic ones, the plaque-causing particles. And that's what we look at with the HeartFit Clinic. So that we look at artery age calculations, we look at artery function tests because your arteries are a muscle. They're not a pipe.
That's right. We think of them as like, a lot of people think of them as just like a straight hard line that's going to get your blood here or there.
Yeah.
But they're malleable and movable and they need to be exercised, right?
If I get the listeners to even just make a circle with your hand, with your thumb and your first finger there, that's what the inside of the artery looks like. It's all skin, right? And so it's not a pipe. And so there are specific ways in how we want to treat that.
Right.
Yeah.
Now, just popping back to this article here in the New York Times, find it so interesting why so many people are agreeing to the stent procedure, putting themselves at risk for a placebo effect. What I know of heart stents is that they are like a Band-Aid.
Yeah.
They are a one-time fix.
Yeah.
And I didn't get a chance to read through this whole article, but it's very interesting about the placebo effect and its effectiveness.
Yeah. And it all stems from... You can talk to cardiologists all day long and they all have their different perspectives on it. But if you really think about how we want to treat heart disease, heart stents are best used if you're having a heart attack. Right. If you're having an acute event, go to the hospital. Yeah. Not us. We'll see you afterwards. But that's where it's important. Now, if you have to drive, so I'm going to talk about the path of that stable heart disease patient. So someone goes sees their family doctor. They get sent to a cardiologist. They get an exercise stress test, right, where they walk on a treadmill. Okay. And then the next, I do not like this test for two reasons. Number one, either you're given a clean bill of health when you can still be on the path of a heart attack or stroke. Right. Right, because the majority of heart attacks and strokes occur with blockages that are less than 50%. So the HeartFit Clinic bridges an important gap there. Right. So we want to see where your risk is before it starts to show up on that. Exactly. Because the majority of heart attacks occur with blockages that won't even show up. That's right.
So traditional quick testing doesn't show that. Yeah. At the HeartFit Clinic, you guys are able to really dig down.
Exactly. And it's an important, don't get me wrong, an exercise stress test is a good starting point.
Yeah.
What I don't like about it is the outcomes from that. Right. And so number one is either you're given a clean bill of health, or number two, you're going for what we call nuclear testing, nuclear stress testing, myocardial perfusion imaging, called a thallium scan, a MIBI scan, whatever might be the dye that's being used. But my problem with that test now is we call it non-invasive, and it's not non-invasive.
Why?
The concern is that you're walking on a treadmill, we inject you with a radioactive dye, and now we're seeing how that dye redistributes inside the heart muscle itself. And there's a lot of radiation involved with that. Oh. So, and to be specific, there's about, it could be anywhere from 600 to 800 chest x-rays for the patient.
So you do not perform that test?
No, that's done in our healthcare system. So I wanted to talk about that part. So most people will go from an exercise stress test to a nuclear stress test and then find themselves doing an angiogram, right? And an angiogram is one of the best tests to see where blockages are, right? Because we insert a catheter through your wrist, we come right in through the artery, and we flush the heart with dye, and we can actually see what percentage of blockages you have. And if there's a blockage there, well, we can fix it. Right. Well, we meaning cardiologists, they fix it. And so the concern with that is, and that's what the article shows, is based on the Orbita trial that's in Lancet Journal, and that's why the New York Times picked up that article, is that we're still doing heart stents when we should not be doing heart stents. And so if someone has chest pain, which is stable, meaning it's predictable while you're exercising or what's going on from that perspective, or if you have artery blockages, that's where another gap that the HeartFit Clinic fills. And so we have lifestyle education, and I call it our 3 E's, really.
Okay.
So external counterpulsation is one of my best treatments to help you grow new arteries, improve artery function, and improve heart function.
Okay.
So that's one of our best treatments that we use. The other E is exercise.
Yes.
And that's exercise, in my opinion, is the best medicine. I talk about it a lot in the book there. And the other part is education. And of course, that goes a lot in the book, Beating Heart Disease, as well. At the HeartFit Clinic, you can get your copy there. But the last part, education, we're focusing on nutrition. We're focusing on supplements. We're focusing on
stress reduction,
and a lot more. And it's really about those 3 E's, that how we can remember, your arteries are a muscle, right? They're not a pipe. And I should coin that phrase.
You should.
Yeah, I think it's in the process of it. But anyway, the point is that it's really about understanding that part of it.
Right.
And if you can see that, okay, we have to treat this artery a lot differently than putting a Band-Aid on it, right? For stable heart patients.
That's right.
Right.
So really long-term prevention, and it's more, you specialize in the heart.
Yeah.
You're about hearts. That's your job.
Of course, yeah.
You're filling gaps that you can't, testing stuff that you normally can't get through our system. You work very closely with cardiologists.
Mm-hmm.
But what you are concentrating on is prevention and lifestyle and all of the pieces that can bring a person to better heart health.
Yeah. And, for those people who have heart disease, I mean, we see two different populations. We see people who want to know what their risk is, right? Whether you have a family history, high blood pressure, diabetes, whatever it might be.
And I was going to ask that.
Yeah.
I was going to, sorry to cut in, but who should be giving you a call? There's people that, and we'll get to that segment in a moment, that have heart disease. They've had a heart event. They've had some sort of a diagnosis. There's people like myself who maybe it's in the family. Maybe there's risk factors, right? I'm not a smoker, but maybe you're a smoker in the past. Lack of exercise, high stress. If you're falling into those areas, you're a candidate that should be making a call.
And so we have an integrative approach to finding out where your risk is. And then, so we fill those gaps. So like I said, if you go to your family doctor, there's not much that they can do to see where your risk is of a heart attack or stroke. It's just unfortunately what it is. And if they are a little bit more proactive and they send you to a cardiologist, they're only looking for advanced stages of disease.
Right.
And we fill that gap. Right. And so with our most accurate screening test to see where your risk is of a heart attack or stroke in the next 5 years, with a protein unstable lesion signature test that we do, that is one of the best tests that we can do to see where your risk is of a heart attack or stroke. Right. And if you are at risk, we can reverse it. And that's something that we guarantee at our clinic. We guarantee improvement in that part of it.
And what sorts of improvements have you seen? You've probably seen a lot of patients.
Yeah. That's the most fun part of my job.
I'll bet.
And if I call it a job, it's just so much fun. That's why we have so much passion in what we do. And, it's about really treating the person as an individual and understanding where that person's risk is, and then reversing it with different strategies. Not everyone's going to be the same. We're not going to focus always the same nutrition. People.
Everybody's individual.
Yeah.
Everyone's different. The plan is going to be different. The one thing that's the same is that you are the specialist for the heart problems, right? And the concerns. And I think, I'm pushing 50, and I have heard of stories sprinkled throughout, my experience of very healthy, fit individuals.
Yeah.
And drop dead.
Yeah.
A heart attack. And people are like, what? How is that possible? Okay. You're starting to explain that, why that's possible.
And I'll explain that. But, I can't remember his name. Bob Harper, was it? From the personal training Biggest Loser guy?
Yes.
How
America's Biggest Loser.
How much more fit can you be?
Yeah.
Really? I mean, he's the epitome of health, if you want to look at it from that perspective. What happened, right? Everyone knows someone with heart disease. And I just wrote an article in Impact Magazine as well with, treating heart disease as well that way. And it's why can the fit person have a heart attack? Why is it that the thin person, we get all different shapes and sizes that come in through our clinic, and I can't predict your risk unless I start to do some investigation with you, right? And that's why we have the best screening tests at the HeartFit Clinic to see where your risk is of a heart attack or stroke. And if you do have heart disease or are really at risk, we have the best treatment options to reverse disease process.
Okay, I want to know more about the screening process. I want to know more about the treatment. We got to double back and talk about those 3 E's. And there's so much. We're not done. We're here for the whole hour. But yeah. I'm in my brain. I know I have to go to break, but it's like I have to remind to ask him about that. I have to remind to ask him about that. You can go to heartfit.ca and get more information. You can also call 403-870-4348. If you are out of our calling area, it's 877-700-4348. That's 877-700-4348. Again, the website is heartfit.ca. It is Diamond Fernandez, their founder and director. He's joining us today on News Talk 770's Talk to the Experts. I'm Betty Jo Kaiser, and we will be back right after this. Welcome back to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser, and Diamond Fernandez is in studio. He is with the HeartFit Clinic, founder and director, and proud new author. His book, Beating Heart Disease, 5 Powerful Pillars to Prevent and Reverse Disease, available at his clinic, soon to be available in stores. If you want to head to the website, heartfit.ca, a lot of the stuff we're talking about today, there's more explanations on there, some testimonials, or, of course, give them a call, 870-4348. That's 870-4348. Long distance, 877-700-4348. That's 1-877-700-4348. So before we went to break, Diamond, these tests, I need to know some of the tangibles. How long does it take to get in? A rundown of these tests. How long does it take to get the results? Like, I'm one of those people. I want to sign up. Sign me up. Yeah, and I need the tactics.
Yeah, and so we have a number of assessments that we do in our clinic, and a lot of it is blood work. And the reason why we look at blood work is because we're looking for inflammatory markers for heart disease. And so we have tests where we can screen the arteries of the neck, and we can see what the age of the arterial wall is. We have an artery function test where we inflate and deflate a cuff and see how well blood returns back. And then we do a clinical fitness assessment to find a safe level for you to be exercising at, because exercise is part of the 3 E's there, and it's an important thing that we want to make sure that people can exercise safely and effectively. The other tests that we do are all blood work, and so the blood work, it takes 15 minutes to get done, really. And the most important blood work that I like to do, especially with clients, is to make sure where their risk is of a heart attack or stroke in the next 5 years.
Okay.
So basically, I'm able to tell someone, look, there's an accident on the way home here. I need you to take a different way, right? And so let's take a different route. And you don't have to go down that path, right? And that's what we love to do. We like to reverse that disease process. And so the one test that we do is the protein unstable lesion signature. So we're looking for unstable lesions, which are blockages inside your arteries. There are specific protein markers that get unstable. And so we're looking for that risk of a heart attack or stroke in the next 5 years.
Okay.
So that's one test we do. We do a particle size cholesterol testing. So we look at the sizes of the particles. And as I talked earlier in the show, we're looking for atherogenic particles. So there are plaque-causing particles. Okay. And the other test that we do is, I think, is very important. We're looking for micronutrient deficiencies, because if you're deficient in your blood, there's a lot of things, that biochemistry pathways that can help, that can hurt downstream. Okay. Right? So if you have high blood pressure, we like to find out why. Yes, taking a pill for blood pressure is important, but it's also important to find out, why do you have high blood pressure?
Get to the source.
Right? Diabetes. Why do you have diabetes? Sleep apnea, insomnia. The list can go on. Inflammation. Where are you deficient? And so we have a deficiency test to see where that is. And it's one of my favorite tests to get done. And of course, I'm always the guinea pig that gets all these tests done. And it's good because it's important. I have a family history of heart disease, with why I got into this with the HeartFit Clinic. And so those are all the tests that we do the summary of tests that we do. And people can pick a combination of whatever we do. But the point is that we can determine where your risk is of a heart attack or stroke. You're in our clinic for a short period of time. More importantly, we do a very thorough follow-up with you, a care plan, to find out strategies, especially if you are at risk. What can you do to reverse that disease process?
Okay, so if I'm calling on Monday, Am I going to get in within the next couple of weeks?
Yeah, we
for my
usually
assessment?
we usually book patients in relatively quickly, and
And expect to be there for.
our assessments start off at about an hour and a half ish.
Okay,
Yeah.
great,
So,
good. Okay,
and
then
then
how long till you get the results?
it takes about a week or so to get the results back, and then
Great.
we go through that with you.
And then you make an appointment. You sit down and say, okay,
Yeah.
here's the results. Here's the plan to reverse,
Yeah,
prevent, whatever you need to do.
exactly.
You got a whole suite, right?
yeah.
Talk to me about that.
Yeah, that's the, when we sit with someone, and if they do not have heart disease and we're telling them they're at risk, then, it's shocking news. But the good part about it, and this is actually my favorite part of the job, is to help people reverse that process.
Right.
Focusing on the 3 E's. And I'll get into the 3 E's is if you do have heart disease, if you have stable coronary artery disease, if you have chest pain, we have much better treatment options than going through the conventional pathway. And I can say that confidently because we've seen the results from
Yes.
it.
Yeah.
And, ECP is done all over the world, right?
ECP stands for External Counterpulsation Therapy.
Yeah.
And it sounds fancy, but it's been around a long time.
Yeah. It's been around a long time.
And I do want to, do you want to tell me now exactly what that is?
Yeah.
So that the listeners
So-
know what that treatment is. It's
Yeah,
very cool.
yeah,
Brace
and-
yourself.
So when you look at external counterpulsation, it's all external. It's non-invasive.
Right?
It's safe. It's it's a safe procedure to basically, you have these cuffs that go on your calves, like these blood pressure cuffs.
Yeah.
So you have a blood pressure cuff that goes around your calves, your thighs, and then your buttocks.
Okay.
And it sequentially inflates, and it's timed to your cardiac cycle. It's timed to your heartbeat.
Okay.
And so what happens is basically your heart beats, the cuffs relax. Your heart relaxes, the cuffs beat, pulsate.
Pulses. Yeah.
So you get that, that counter pulsation. Heart beats, then the cuffs beat, and the heart beats. So it's almost like an auxiliary heart, if that
How
makes
does it
sense.
feel when you're lying there?
know,
It's because you're lying down, right?
Yeah, you're lying down. I mean, have some patients that fall asleep. They can read a book, get through their emails, whatever it is. But we like to talk a lot as well and give a lot of people some education as to what's going on. So it's you lie in the bed for an hour each time, and it feels like a little bit of a massage, right? And so
How many, does it vary depending on your condition, how many of those treatments one
absolutely.
would get?
If you want to improve circulation, this is one of the best treatments that we have to improve circulation.
Okay.
So when do you want to improve circulation? If you're diabetic,
Right.
If you have some kind of artery dysfunction, right? And these can be masked with that part of it. And one of my biggest pet peeves is that when you go to your family doctor and you're like, look, I'm having problems in the bedroom and I'm not, I'm having sexual dysfunction. A lot of times, we'll give a pill for that, but that's actually a huge marker for heart disease.
Is that right?
Yeah, the arteries going to your sexual organs are a lot smaller than the arteries going to your heart. And so at the HeartFit Clinic, we focus on, some good treatment options to be able to do that naturally, right?
Okay.
It's a circulation concern. It's a, and so that's a big marker. So I like to get people to go through our investigations to see where their cardiovascular disease risk is, right? And so that's one of the things that we do to improve circulation that way too.
So ECP, External Counterpulsation Therapy. Before you opened the HeartFit Clinic here, people would have to fly down to the Mayo Clinic or the Cleveland Clinic to get that kind of treatment.
Yeah, there's a number of centers in the States that do this treatment, ECP therapy, but yeah, we're one of the only ones, actually, we're the only ones that do it in Alberta.
That's fantastic.
Yeah, and so...
And it's considered in some parts of the world, like this is not newfangled therapy, folks.
Oh, no.
In some parts of the world, this is their front line.
Yeah, this is their frontline approach to treating stable heart disease. Yeah.
Wow. And it's available here at the HeartFit Clinic, heartfit.ca. Diamond Fernandez, the director, is joining me here on Talk to the Experts. There's so much information, and I want to make sure we get through it all. What can I do before I even go to the doctor? If we can quickly touch on that again for people that are just tuning in.
Yeah.
Because it's not about... Sure, you see people all the time that have had a cardiac event, have been rushed to the hospital, get fixed, and then they want to get back on the path to health. But what if I'm just driving around in my car right now and I'm like, what can I even do before I go to the doctor?
Well, if you don't even obviously come see us, that's an important step. But even before you come see us, if you want to do a quick little test at home to see where your risk is of a heart attack or stroke, there's two of them. One is that I say you take some floss, start flossing your teeth.
Okay.
And if you bleed, that is actually a huge marker for cardiovascular disease.
Because that's an indication of inflammation.
Yeah,
right.
systemic inflammation.
Okay.
The other one I touched on already a little bit is that if you're having problems in the bedroom and you have sexual dysfunction, erectile dysfunction, that's actually, it's a nice one to practice. But if you're having problems that way or test, if you're having problems that way, that's actually a big marker for heart disease. And it's I don't like it to be solved with a Band-Aid approach of using a pill. And yes, that's, those pills were actually started off using for heart disease patients, right? To dilate the arteries,
Isn't
right?
that interesting?
Yeah. And so
Well,
they
what
found a
often
better market
happens
for it. So
is that people will go to their family doc and they'll get some blood tests done, some blood work, talk about cholesterol. We have talked about that there. But often they can get a clean bill of health. And there's underlying problems that regular doctor's office or even cardiologists aren't performing that the HeartFit clinic does.
Yeah.
So, if you could just nail down again, Diamond, what you do differently.
We bridge an important gap in our healthcare system. And that's the number one thing that we do. So when you go to your family doctor, unfortunately, there's not much in their toolbox to see where your risk is of a heart attack or stroke. Right? They can check for your cholesterol, your blood pressure, diabetes. There's important markers, but you can still be on the path of a heart attack or stroke, and we bridge that important gap. Now, if you go to your cardiologist, the testing that they do is only looking for advanced stages of disease.
Right.
And the majority of heart attacks and strokes occur with lesions or blockages that are less than 50%. So it won't even show up. You could get an angiogram done, which is the most, best test to see what's going on inside your arteries. And if you see small blockages just the day before your heart attack, a cardiologist would ignore that.
Really?
Yeah. It's just,
The
they
test
can't intervene, right?
Right.
And so,
the test just doesn't give the information needed. But the HeartFit clinic, you guys are doing the tests.
Exactly. And so we want to see what happens before that. And so if you have a 50% blockage that let's say you even had done an angiogram before, or even a 60 or 70% blockage, whatever, it doesn't matter, but it's not intervenable, meaning we can't put a stent or bypass in there kind of thing. If you do have that artery that does break open, I call it the pimple on your face. Imagine those blockages like pimples on your face.
Yes.
If it goes from a 50% blockage to 100% blockage, you want to go to the hospital.
Yeah.
That's where they do their best job, right? And that's where heart stents do benefit. I'm not a big fan of using heart stents on a preventative basis. What I mean by that is okay, I have chest pain and I want to resolve it. Or there are much better treatment options that we do at the HeartFit Clinic to reverse that disease process.
Okay, you are listening to Diamond Fernandez. I'm Betty Jo Kaiser. This is Talk to the Experts on 770 CHQR. Check out their website, heartfit.ca. The phone number is 403-870-4348. That's 403-870-4348. Outside of the Calgary calling area, 1-877-700-4348. That's 1-877-700-4348. We'll be back with more right after this. Welcome back again to Talk to the Experts here on 770 CHQR Radio. I'm Betty Jo Kaiser, and joining us is Diamond Fernandez. He's the founder and director of the HeartFit Clinic here in Calgary. Their website is heartfit.ca. You can also give them a call. A couple of numbers, 403-870-4348. That's 870-4348. 1-877-700-4348 if you're out of town. 1-877-700-4348. Diamond, tell us, I want to talk a little bit about the people that are going to the clinic. First of all, what other types of heart disease or what do people have that are coming to see you? You've already mentioned diabetes, for sure. We've talked about people that have been diagnosed with some heart diseases.
Yeah, I'll just
list them off for me.
Yeah, so for the diabetic patient, unfortunately, the majority of diabetics will end up with cardiovascular disease. It's a really sad thing because it affects, remember, your arteries are a muscle, not a pipe. It affects the muscle, right? And so it causes the effect of inflammation in the arterial wall and can have a concern that way. So diabetes are a big thing that we can help people with from an artery disease perspective, right? So that's where our big focus is there. If you have high blood pressure, if you have high cholesterol, if you're taking a cholesterol-lowering pill, those are people that should be coming to see us, see the options out there. Because unfortunately, especially if you're taking it on a preventative level, like no one wants to be on a medication for the rest of their life. And now in this day and age, I mean, you can go research the benefits and all that at the fingertips of your thumb, before you even go into the doctor's office, right?
Hit the Google.
Yeah.
Absolutely.
So everyone can Google everything, what's going on and stuff. And so, those are big populations that we see on a preventative level, or even just for those people who are concerned about their heart.
Right.
And then I have a lot of people who have chest pains and they're concerned about it, and they're maybe getting close to an age where they want to think about it. And so it could be over 40 or over 50. And you're like, okay, well, you know what? I I got a family. I want to be here for them, and I don't want to ignore this part of it. And that's really a big population I'd like to see, because this is a reversible disease. You do not have to go down that path. And that's we have the best screening test to see where your risk is of a heart attack or stroke. And that's a big population that we see on a preventative level.
Diamond, I would like a couple of examples. Tell me about a patient who is in that category. They want to prevent. That you can think of, someone that gave you guys a call up, checked out the website and said, I need to know more. I need to know if that could be me.
Yeah. And I can think of quite a few, but I'm going to get specific because I'm going to take someone who's not, regularly thinking about it. I had a patient who came to see us recently. He has a family history of heart disease.
Okay.
Father had a heart event. I think he was in his just under 60 years old, and he was 38 years old.
Okay.
And he plays hockey, does all these active things. Yet, you're at that age. Actually, he was a little bit older than that. But anyway, the point is, he was around 40 years old.
He has a concern, and he had a family history.
Yeah, all he had was a family
young
history
with
of
the
heart
heart
disease.
Yeah.
And so it's good that he came to see us, because he found out where his risk is of a heart attack or stroke. And it just gave, when we did the testing with him, he actually came out elevated in risk. And
he did.
Yeah. And
was he shocked? Was he upset?
Yeah, of course he was shocked. But then, the beauty of it is that we repeated that test and just followed some of the recommendations that we did, and got really aggressive with some of the things that he was doing. And he actually reversed his disease risk.
Yes.
So we have a green zone, a yellow zone, and a red zone.
Okay.
And we like to get people in the green zone.
Yeah.
Right.
Yeah.
And so if you're in the red zone, we can reverse that process of it. Right. And that's the fun part of what we do. And there's countless of stories like that where we can reverse people's risk that way.
So this dad comes in, he goes through the testing. Testing you can't get anywhere else except the HeartFit Clinic, because you're able to fill those gaps.
Of course, yeah.
You set up a treatment plan for him. 3 E's? Did he get the ECP or
we
more
didn't do
exercise and
ECP
education?
therapy. We just focused more on his nutrition and specific to him. Like, we got really dove in, dived in deeply to his situation.
Okay.
ECP wasn't a situation with that.
He didn't need that.
Yeah.
Right.
I'll give you an example of someone who came to see us. So when someone came to see us, they actually had a stress test, and then they ended up with a thallium scan, the test I don't like.
Right.
So, which is a perfusion scan. So it's a nuclear stress test.
So that was done.
So it was done in Calgary here.
Through the system.
Yeah, he was at risk. He has chest pains.
Ooh.
Right. And so he was recommended to do an angiogram.
Okay.
And it was booked far out. Right. It was booked far out. And so we know his risk. We know what's going on.
This is a big flag already.
And we already know that he has heart disease, so it's already a concern. He did our ECP therapy, and actually I can think of a guy and a girl in the same boat that way. But anyway, the point is that we see so many people in a day. But I'm going to talk specifically about this guy. He was scheduled for an angiogram. It was actually 2.5 months out. He said, "Okay, I'll do your treatment, the ECP therapy," and he did our treatments and actually. Did our treatments and exercise at the same time, because we focus on exercise therapy, and listened to us because he didn't want to do the angiogram.
No.
And you shouldn't, based on the study now, right? Based on the new research out there, you do not want to do an angiogram. Why do an angiogram when you can medically treat someone much better? And so that's what the study showed. Well, I like to go even further than medications, and I can get in a whole little talk about medications alone. A big question that we should be asking is, what is the number needed to treat? Like, what number am I to treat? So just quickly on that story, if I'm taking a cholesterol lowering drug and I'm taking it on a preventative level, if it's got a number needed to treat of 50, that means that 1 in 50 are going to benefit from taking that drug.
Okay.
So you always got to find out the number needed to treat. Whenever you're taking drugs, you should always know that. If you got a bacteria infection, what's the number needed to treat, doc? And they should answer that question for you. So that's important, because you want to know your odds of me. I'm going to take this pill every day. What is it going to do for me?
What are the chances?
Right?
Yeah.
And so anyway, the point is, getting back to that gentleman's story, he did ECP therapy, which is external counterpulsation. He did 35 treatments of that, did the exercise, and never ended up having to go for that angiogram because he wasn't getting that chest pain anymore.
You reversed it.
Yeah. And we can actually see the changes that way.
That's cool.
He did a very thorough investigation with us. We reversed that process of it. We reversed his risk. We took red zones into green zones. And, it's
awesome.
That's the fun part that we do.
That must be so gratifying for you and your team.
Oh, and we hear stories like that. Like, there's countless of stories. A lot of people that have stents or bypass surgery in the past and are like, well, how long is this going to last for? Like, it's just,
Oh, am I taking time bomb?
you know,
when am I going to have another heart attack?
yeah. And so every little thing that happens inside your chest, you're worried, is this another heart attack, or is this going to be the time, or whatever it is, and you're worried about that. That's what the HeartFit Clinic focuses on, is bridging that important gap so that we don't want you to worry about it. We want to empower you and be dealers in hope, if that makes sense, to reverse that disease process.
I love it. It's heartfit.ca. Diamond Fernandez is the director. He actually is a brand new author, brand new book, Beating Heart Disease, 5 Powerful Pillars to Prevent and Reverse Disease. That is available at the clinic. Again, heartfit.ca. Give them a shout, a 403-870-4348. Or long distance, 1-877-700-4348. We don't have a ton of time, Diamond, but I sure wouldn't mind just once again reinforcing the HeartFit Clinic is bridging the gap.
Yeah.
Family Doc is a great first stop. We need those cardiologists. If you are having a cardiac event, you're going to the hospital, we need our cardiologist.
Absolutely.
What the HeartFit Clinic is bridging a gap. You are providing deeper tests, you're helping with prevention, you're also helping with treatment. And folks, this is the thing I love about it. This is it for Alberta. You know, if you want some of this treatment and some of these specialized tests, you're heading down to the Mayo Clinic or the Cleveland Clinic, but you can have it done right here in Calgary.
Yeah.
And I'm really excited about that. I'm a Calgary girl. What can I say?
Of course.
So can we just really talk again about that ECP? Because that is such a cool, unique therapy that's it's been around for a long time, but you just can't get it in this part of the country.
Yeah, and I want to also say, like, with the HeartFit Clinic, we focus a lot on other different types of diseases, whether it be heart arrhythmias, atrial fibrillation, heart failure. So external counterpulsation is actually meant for patients who have poor circulation. So if they want to improve circulation, diabetes, coronary artery disease, heart failure. If you have a heart function that's not working as well, we want to improve as much blood flow to that heart muscle as possible. And that's what ECP focuses on. We have it's one of the best things that we can do to help people really grow new arteries, improve heart function, artery function, and a whole myriad of other benefits for sure. But that's one of the big things that we do with external counterpulsation. And it's a treatment that is only available to us here in Calgary. And it's a safe, painless, non-invasive treatment to really, when we increase circulation to your body, so many more good things happen when we're focused. And that's why the study doesn't work as well. We've had stents compared to exercise. We have stents compared to medications. We've had heart stents compared to, not doing it at all. And like the last study shows, the Orbiter trial you were talking about in the New York Times. These are all, you don't want to treat a vessel like we're talking about a small little section of the vessel. We focus on the whole cardiovascular system. And when you focus on the whole cardiovascular system, and growing new vessels around that blockages and improving heart function and artery function and, the growth of new vessels, you get so many compound benefits from that.
That is so fantastic. Once again, folks, it is the HeartFit Clinic. Heartfit.ca is the website. We're right out of time. Thank you so much for joining us, Diamond Fernandez.
Thank you.
403-870-4348, 1-877-700-4348. Once again, heartfit.ca. I'm Betty Jo Kaiser. This has been another edition of Talk to the Experts on 770 CHQR.